In this video, we are discussing regarding the previous questions that is held on 2015 Staff Nurse Temporary Exam Paper. So we will move on to first question. The first question is, nurse teaches the patient to rotate the site of insulin. Which of the following site is inappropriate to use? Options are thigh, abdomen, forearm, upper arm. The correct answer is option C, that is forearm. Next question. Effects of nicotine will increase the body's secretion of. Options are thyroxine, epinephrine, pancreatic juices, histamine. The correct answer is option B, that is epinephrine. Next question. Therapeutic effect of digitalis is to. Options are dilate coronary arteries, increase arrhythmias, strengthen the heartbeat, decrease the electrical conductivity of the heart. The correct answer is option B, that is strengthen the heartbeat. Next question. Significant nursing interventions required for a patient with activity intolerance include all except. Options are encourage ROM exercise, that is range of motion exercise, use wheelchair for transporting, give only fluid diet, encourage the patient to choose activities to build endurance. The correct answer is option C, that is give only fluid diet. Next question. The part of the brain which control heart rate and respiration is. Options are cerebral cortex, thalamus, medulla oblongata, diencephalon. The correct answer is option C, that is medulla oblongata. Medulla oblongata is the part that controls the heart rate and respiration. Next question. Claustrophobia means. What do you mean by claustrophobia? It is a fear of darkness, fear of being alone, fear of height, fear of closed spaces. The correct answer is option D, that is fear of closed spaces. Question number 7. Which of the following term is an extrapyramidal symptom? The given options are rigidity, dry mouth, photosensitivity, urinary retention. The correct answer is option A, that is rigidity. Question number 8. The condition in which excessive fluid moves into the intracellular space and all body fluid compartment expands. So the condition is called options isotonic overhydration, hypotonic overhydration, hypertonic overhydration, hypertonic dehydration. The correct answer is option B, that is hypotonic overhydration. Next question. Hypernatremia is commonly detected in patients. Options are on corticosteroid, with fever, with diarrhea, on degaussing. The correct answer is option A, that is on corticosteroids. Question number 10. Mr. X is on diuretics and digoxin. Recent serum potassium value 2.9. Which of the undermentioned food item is essentially required for the patient? So, the options given are milk, green leafy vegetables, oranges, whole grain cereals. The correct option is option C, that is oranges. Question number 11. Mr. Y is on low sodium diet. Choose the most appropriate food item from the undermentioned list. The options are bread with jam, cheese, banana, tomato ketchup. The correct answer is option C, banana. Question number 12. Milk is a rich source of. The given options are vitamin A, D and B2, vitamin C and K, vitamin E, vitamin B6 and B12. The correct answer is option A, that is milk is rich source of vitamin A, D and B2. Question number 13. Indication of low residue, low fiber diet is options are asymptomatic diverticular disease, constipation, inflammatory bowel disease, renal failure. The correct answer is option C, that is inflammatory bowel disease. Question number 14. Mr. P was brought to the casualty following accidental fall from a tree. He was transferred on a trolley. Suddenly the nurse noticed a cessation of breathing and unresponsiveness. The patient technique to open his airway is options are head tilt chin lift maneuver, low thrust maneuver, abdominal thrust maneuver, ambu ventilation. The correct answer is option B, that is jaw thrust maneuver. Question number 15. Choose the inappropriate action of the healthcare provider while performing BLS. Options are determine unconsciousness, open airway, defibrillate, auscultate for heart sound. The correct answer is option D, auscultate for heart sound. Question number 16. What is the approximate hemoglobin in a normal newborn at birth? The options are 10 to 12, 14, 15 to 20, 21 to 20, 25. The correct answer is option C, that is 15 to 20 gram per 100 ml of blood. Question number 17. In a post-operative patient, Staphylococcus aureus found normally on the skin can cause options are cold sore, pneumonia, wound infection, urinary tract infection. The correct answer is option C, wound infection. So in post-operative patient, Staphylococcus aureus will cause wound infections. Question number 18. Braden scale is the assessment tool used for predicting the severity of the options are brain edema, pressure ulcer, myocardial ischemia, cerebral ischemia. Correct answer is option B, that is pressure ulcer. Question number 19. What is the maximum storage life of platelet concentrate? The given options are 3 months, 2 weeks, 30 days, 3 days. The correct answer is option D, that is 3 days. Question number 20. What do you mean by pulse deficit? The given options are missing of a pulse in normal pulse rhythm, difference between systolic and diastolic blood pressure, difference between pulse in sitting and standing position, difference between apical and radial pulse. The correct answer is option D, that is difference between apical and radial pulse. Question number 21. When a person is infected with HIV, antibodies can be detectable in the blood. Options are at time after the exposure, 48 hours after the exposure, 2 weeks after the exposure, 3 months after the exposure. The correct answer is option D, that is 3 months after the exposure. Question number 22. The nerve which supplies diaphragm. The nerve which supplies the diaphragm is options are phrenic, sciatic, trigeminal, accessory. The correct answer is option A, that is phrenic nerves. Question number 23. Cushing triad is options are high BP, edema, oliguria, slow pulse, abnormal breathing pattern, high BP, hypoxia, increased temperature, tachypnea, so slow pulse, hypoxia, pupillary asymmetry. The correct answer is option B, that is slow pulse, abnormal breathing pattern and high BP. Question number 24. Which vein is the most common source of thrombi that become a pulmonary embolism? Options are great saphenous vein, iliofemoral vein, popliteal vein, posterior tibial vein. The correct answer is option A, that is great saphenous vein.